Well, these moments always leave us with lots of questions, and I'm pleased to say that public health expert Dr. Bharat Pankhania is here with us tonight. We've got to say, of course, he is independent of the government and his views are his own. Dr. Pankhania, lovely to see you. How are you?
I'm very well, thank you.
Good, always good to check. Now, I'm going to dive straight into the questions, if that's OK. First of all, Bernard asks, I'm a key worker, I shielded in the past, do you recommend I do it again this time?
Yes, Bernard, it is important because obviously you were a key worker and a shielding person for a reason. So if you have to shield in the lockdown #1, then it is very important that you also take all infection control measures now. If you're not sure, check with your GP. That's also important.
OK. Jeff from Watch It says his granddaughter, who's 10, was diagnosed positive, but she didn't have any symptoms. Her mother and younger sister didn't catch the virus, even though they were in isolation with her for 14 days. So he's wondering, did his granddaughter ever have the virus, or were the results incorrect?
No, if a result is positive, we can be pretty sure that they have had an encounter with the virus. That much is absolutely, I'm comfortable with. But what we have found actually, Alex, and this is really important, that we find that if you mingle within your own group, you're somehow okay. Whereas if you mingle with other groups of people, the chances of getting infected are higher. So it doesn't surprise me that within the family group, there wasn't a transmission of infection. We've come across this before.
Wow, it does surprise me. That is new. Thank you very much for that. Now, people have a couple of questions about smoking and vaping. Can the virus be transmitted when people smoke or vape? That's from Christine in Warminster and James in Bath.
We don't know, because you see, what you are releasing when you vape is the moisture, the plume, the smoke, rather than virus particles. But having said that, it does make you feel very uncomfortable. And that's another reason for us to wear our masks to protect ourselves when we are in a, shall we say, uncomfortable situation with somebody's plume going past our nose and mouth.
Miriam Nichols says, if people are recovered from the virus, what restrictions should they be observing?
All restrictions, all of them, because one, we don't know if your immunity is going to protect you against a second infection. We think it will, but it is better to be cautious and exercise all precautions that you did before you got infected. Wear your mask properly, keep your social distancing, don't go into crowded places, all of them.
Roger would like to know, are there restrictions on the duration and location of daily exercise?
The essential point is that you don't mingle with other human beings. Like we've repeatedly said, keep away from other humans. So therefore, if you are exercising out in the street, going for a long walk, I don't see anything wrong with it. Similarly, if you are going running in the countryside or cycling, those sort of activities not involving other people, they're perfectly safe. And in fact, we should encourage them. And
also from a legal point of view, you can always have a look at the government's website for how long and where.
Yes.
We have romped through loads of questions. I wish we had time for more. Dr. Pankhania, it's a pleasure to see you, and thank you very much for joining us again.
Thank you.
Thank you.
Stay safe.
Thank you for your questions.